Now, BBL or Brazilian butt lift is an extremely popular procedure which patients love. By the way, surgeons love it too because of its extremely transforming nature. However, many of our patients come with questions and doubts and concern regarding BBL safety because there has been a lot of press around BBL potentially being dangerous and even fatal. Now, there's a relatively simple answer to that question, and I want to lay this out to put our patient minds a little bit at ease, because we perfectly know what is the potential danger factor in BBL, and that potential danger factor is injection of fat into the muscle, which you must not do under any circumstances. However, with the wrong technique, you might do it inadvertently without wanting to do it, because the surgeon, if he doesn't do the technique correctly, he might not precisely know where he's placing the cannula, because originally this technique was blind, so you would just feel the cannula. You couldn't be sure if you might not have ended up in the muscle. So you see in this illustration, we want to bring the fat into the fat layer, into the tissue between skin and muscle, the so-called subcutaneous or superficial fat layer. And while it is relatively easy to place the cannula in a thicker fat pad, if a patient is a bit thinner, then you might end up getting the cannula into the muscle, and then that can put your patient into danger. Now, how can we avoid this? And this is actually very efficient and very simple. What we do is we apply ultrasound-controlled delivery. And I hope this illustration here makes sense. So basically what you see me doing here, I've got a handheld ultrasound, I've got the screen in front of me. I place the cannula in the superficial fat layer. So I'm 100% sure where my cannula is. It's not in the muscle, I can see that. And then I can graft and deliver my fat. So that is, if you do it correctly with so-called expansion vibration lipofilling technique, a rigid cannula, which is 100% controllable, plus ultrasound control, that makes BBL, in my eyes, and I'm very firm in this position, actually a very safe procedure if it's done in the correct way. I think this is it's more than appropriate to give credit to those colleagues who have actually first described and invented this, and I've got the great privilege that they taught me, which is Dr. Dan Del Vecchio from New York and Dr. Pat Pasmino from Miami, who have done a lot of pioneering work in evolutionizing and describing this procedure first. So big shout out to them, and their technique really has made BBL safely if done right. Now, as you see in this case example, it's a wonderful surgery, very, very enjoyable, again for patient and for surgeon, because the before and after pictures are really great. However, modern BBL, if you're looking into BBL, make sure that your surgeon is really trained and knowledgeable and in EVL, modern EVL fat grafting and ultrasound control. It's not enough that somebody waves around with an EVL handpiece or an ultrasound, that he must know how to use it. So I usually think it's best to cast for a surgeon who is really specializing in BBL. Surgeons do the same thing. When I look for a procedure like for a hair transplant, then I will look for a guy who only does hair transplants, because he will then have most caseload experience. And the same applies to BBL. If you focus on that, if you only do that, if you're trained in the right way to do it, then it's a very safe and enjoyable procedure. And I hope this helps to put patients' mind at ease and differentiate a little bit between truth and myth around BBL surgery.